But it's not just about healthcare. It's about, as Marcus Batchelor and others have said, it's about how that healthcare relates to our children and our young people. And so right now, I want to bring to the stage Elizabeth Davis, the president of the Washington Teachers Union, to talk to us a little bit more about what is going on with healthcare and our youth.
Thank you and good morning. I'm here to represent the 5,000 plus retired and active teachers in DC public schools, because one of the things we certainly want the community to know is that teachers care about all of the conditions that affect our students. And as a teacher who taught in Ward 8 and 7 for more than 30 years, I am fully aware of the inequities that continue to exist long after the March on Washington around health care, housing, and education. And one of the things that we do not understand is how is it that elected officials who say they care about children, they care about the fact that we have grown an achievement gap between black and white students in this city that is now at 52 scale points over the course of the last 10 years. If we care about students, we need to care about the conditions that affect them. We have over 6,000 students coming to our public schools every day from homeless shelters. We have students that are dying on the streets of our city every day. And some people refer to those numbers as simply that, numbers. But the WTU has begun to put faces to the names of those students who are killed on the playgrounds, on the streets, outside of their homes and their schools every day. The numbers are accumulating, and there is not enough outrage for me and our members, teachers who serve students on a daily basis, know that it is impossible to separate those conditions that affect our students and whether or not they can focus on what we're teaching. The fact that we have students who are displaced in a city that boasts of having over a $2 billion reserve, but yet students who are living in shelters, students who are dying on the streets, coming to school every day with excessive amount of baggage from the trauma that they experience, and legislators who are passing laws that are unfunded for social and emotional learning, for trauma-informed teaching, a hospital that you want to build without critical care. What is the message to the students and parents and the families of those students? You are not valued. You are not worthy of quality services in education, housing, or health. And it's time out. Unacceptable. Individuals that we vote, elect to represent us and our communities and our children and their families, when they're not doing their jobs, I suggest that we do what happens to teachers when they're not doing theirs. We dismiss them, look for new ones to replace them, and move on. But health care is critical to our kids, and we cannot allow legislators who purport to be concerned about the lives of our children ignoring the critical care services that they need in order to thrive. So fund our hospital, the 5,000 members of our local, and the 8,000 retired educators who live and have taught in DC are behind you. Thank you.